When we talk about knee injuries, what exactly are we talking about? So obviously it occurs on our knee. Tinoziva kuti knee ndicho chitsitsi nomushona. So that's the knee, and here it's a picture of a knee dislocation. So as you can see, bonzo iri rofangu richidi richinyatsokuenderana nerino iri seizvi, but rabva apa it is dislocated. So this is a knee dislocation. The knee is one of the most commonly injured body parts during physical activities. So that's the first point. The knee is one of the most commonly injured body parts during physical activity. Common knee injuries include, so we should know that the knee is one of the most commonly injured body parts, but as a note, we should appreciate the common knee injuries. These include sprains. So we have sprains, then we also have dislocations, like what we see on that picture there, dislocations, then we have fractures. So when we talk about a fracture, this is a case where the bone is actually broken. So fracture kutovhunika kwebhonzo. Dislocation occurs at the joint where we have bones being dislocated. So this is the joint area and where we have our kneecap. Then bones are move out of place. That's a dislocation. Then we have what are called sprains, which is as a result of stress on that particular area. These injuries can be caused by twisting or bending forces applied to the knee or by a direct blow during sports, falls, or accidents. Saka, we want to look at the causes of knee injuries. Very important. What are the causes of knee injuries? So for the causes of knee injuries, we have twisting, kumonyorora, and we have bending forces. So these bending forces, they are applied on the knee area or applied to the knee. We can also talk about a direct blow. So bending forces, kuti tinyatsonyora yakazara, applied to the knee, applied to the knee. Sakapa, it's twisting the knee. Then we talk about direct blows. So these direct blows during sports. Let's take an example. Kutemwa neka, let us say baseball ball, kabora keke, kovaka kutema pani area, usana kufeka protective clothing, which should be worn when you are playing the sport of baseball. That can lead to a knee injury. We can speak about whilst you are running, whilst playing soccer and you fall, that can also lead to knee injuries. In the case of soccer, we can talk about knee dislocations and other common knee injuries, sprains or fractures. So direct blows during sports are also a cause, but you can actually have a direct blow during falls, kudona, or accidents. They can also result from overuse, improper training, sudden changes in direction, or participation in high impact sports. So further causes of knee injuries. What are the further causes of knee injuries? What are we looking at? We are looking at they also result from overuse. Saka kutoshandisa your legs, in this case, overusing them, that can lead to knee injuries. So we can say overuse of legs, because the knee is part of the leg. What else? Improper training. You have to be trained properly. So improper training is also a cause of knee injuries, but this is important if there are sudden changes in direction. So sudden changes in direction, they can actually cause stress on the knee area. Or another point, participation in high impact sports. What are high impact sports? For example, we can talk about like rugby. It's a high impact sport. So when we talk about high impact sports, tukutaura masports ekuti munenge muchidhumana stereki. And saka we have low impact sports like tennis. And there is no contact, so less impact. But we have high impact sports like soccer, especially rugby. So the level of being high impact varies with the sport. So this is what we wanted to learn as pertaining knee injuries. Let us now look at tendinitis or tendonitis. So you can call it tendinitis or tendonitis. Before we get into it, I want to take you aback kune zvatambodiscussa earlier in this lesson. We said injuries affect bones, joints, ligaments, muscles and tendons. Saka tendinitis or tendonitis, we are now looking at the injury to tendons. And when we spoke about knee injuries, this was an injury to a joint because there is a joint here. And when we spoke about muscle pull and strain, that was injury to muscles. So we spoke about injuries associated with joints, then injuries associated with muscles. We now want to look at injuries associated with tendons. So what do we want to learn here? Tendinitis or tendonitis is a condition in which the tendon, the tissue that connects muscle to bone, becomes inflamed. So let us say this. Let us define a tendon. So a tendon is a tissue. That's toilet, by the way. So it is a tissue that connects muscle to bone. That's what a tendon is. So look at this. This is a bone, and we have a muscle which is connecting, a tissue rather, which is connecting muscle to bone. Saka, you have to understand these differences. We are going to have tissues. So I want to give you this as research. We are then going to have muscles. And lastly, we have bones. You have to know the differences between these things. So a tendon is a tissue that connects muscles to bones. Okay. So if this tissue connecta bonzo nemasuru, tikataura in Shona, if it becomes inflamed, we have a condition called tendonitis. So tendonitis is a condition where the tendon, muscle connecting tissue to bone, is inflamed. And inflammation, pama graphs edu panapa, kana pama pictures edu rather, tinoiratidza this color red. This represents pain, to inflame, in simpler terms kupisa. Saka you see this pange pachipisa pachirwadza. And it is commonly caused by overuse or repetitive motion during physical activity. And an example here is Achilles tendinitis. As you can see, this tendon is inflamed. We have many tissues connecting muscle to the bone. Saka akarwadza yao, that is a case of tendinitis. We are interested in knowing the causes. So causes of tendinitis. What are the causes of tendinitis? The first cause, overuse. Saka kuramba muchipashandisa, abuse or overuse. Then secondly, we talk about repetitive motion. Repetitive motion during physical activity. So repetitive motion during physical activity. Saka tiri kumhanya, tutamba sports, bora, chichi. But we are continually and repetitively using a certain muscle. That in itself is going to cause tendonitis, where tendons are inflamed. So after we have learned about the causes of tendonitis, what are we concerned with now? Takuda kuziva common types of tendonitis. Kana kuti tendinitis, but inini I just prefer to call it tendonitis because zvinoenderana nekuti tendons. Some common types of tendonitis include number 1, or ngatiti A. What is it? Tennis elbow. Imagine the sport of tennis. You are frequently and repetitively using your elbow kurova the tennis ball. That can lead to tendinitis. B, golfer's elbow. Murikuona kuti titori nemasports anotokonzeresa this injury. So golfer's elbow, because of repetitive overuse while he's striking the golf ball. Then example yataona in picture, Achilles tendinitis. Taona tinafakita tsoka, it affects the foot. This tendon, which is connecting this bone to a certain muscle, is affected. So we have this bone, we have this muscle. This tendon connecting the bone to the muscle is inflamed. That's why we have Achilles tendinitis. We can talk of a D, which is swimmer's shoulder. That's also a common type. And lastly, wrist tendinitis. Saka tendinitis, this is an occurrence. We have tendinitis in places where we have joints which are frequently or repetitively used. Ndosaka tine tennis elbow, golfer elbow, Achilles tendinitis, swimmer's shoulder. So you see the sports: tennis, golf, swimming. Then of course wrist tendinitis. So those are the examples of tendinitis.